Hey you guys, so I found this article and I wanted to share it with you. So nurses call for change as many reveal they're extremely likely to leave profession. Emotional, stressful. And this is the truth. So this survey found that more than half of nurses are likely to switch jobs this year. Nurses aren't optimistic that this year will be any different than last year, and more than 1/3 of them are extremely likely to change jobs. That's according to a new survey by AMN Healthcare, a healthcare workforce solutions place based in Texas. The majority of nurses, 80%, say they think that 2024 will be either no better or worse for our profession. Only 20% say they believe this year will be better than last year. In light of 35% of the nurses surveyed said it is extremely likely that they will change jobs in 2024. And the majority, 55%, said it is very likely or somewhat likely. This is crazy. And this was from surveying 1,155 nurses. So, yes, let's be honest, COVID really put nurses through a whole lot. But the concern that many nurses have about their profession were not created by COVID-19 and have not gone away since the crisis has resolved. Many nurses still feel overworked and undercompensated. What they want to see is a change in their daily work conditions, better hours, fair compensation, and more time with their patients. We've been talking about this forever. Unsafe patient to nurse workloads. This is not just a nurse morale issue, it's a public health issue because when we are overworked, we cannot engage with our patients, our workforce is less productive, and that means that the patient outcomes are going to go down as well. While the healthcare industry is acutely aware of this, and they have been for a long time, research supports this, the survey shows that more work needs to be done. Of course, we know that. We know that. So they've surveyed nurses regularly over the past 4 years. Like I said, they've been knowing, and the data consistently shows that around 30% want to leave their roles in direct care because that's where the abuse goes down. That's where it is most problematic, taking care of patients directly. We also done additional analysis and have projected a shortage of nurses in patient care, which is also concerning. The shortage has been going on for a long time. This is not new, okay? The number of nurses that are currently leaving the profession is the highest level I have ever seen. And they probably are going to be also the most qualified, which is why the floors are filled with baby nurses training new baby nurses. I mean, it's sad, but this is what our profession has come to. It says even more concerning is the level of nurses leaving the bedside for non-traditional nursing, like going to a clinic or doing Botox injections. If this trend continues, we face a significant shortage of nurses to provide care for our aging society. Now they know this, but what are they going to do differently? And when I say they, I mean the leadership, the higher ups. Reasons for nurses burnout, which have been historically the same. There are many reasons for nurses' high levels of burnout. Nurses are called on daily to perform in stressful situations that are emotionally and physically damaging. Patients are calling and requesting that you bring them a spritzer. Bring me a cranberry juice and Sierra Mist spritzer, even though I have all these patients that need me. I have to pass out meds, pain meds, help a person to the toilet. That cannot be my priority, but they want it to be your priority. We have patients who do not know how to keep their hands to themselves. We have patients, I've had a patient throw urine on me. We have patients demand that you wipe their butts while screaming at you. Our jobs are so physically and emotionally demanding. If you're not a nurse, you won't get it. You have to be there to get it. And those who get it, get it. And let me tell you personally, as a nurse who started out on the med surg floor, I left the floor because of nursing being emotionally and physically draining. I totally admit that, and I can't say I will ever go back to being a med surg nurse. Nurses were asked to work longer hours with less resources for providing care. Often nurses are asked to care for more patients than they feel they can safely accommodate. Yes, they will give you as many as you shut your mouth up and agree to take care of. Your job is to focus on your license and your scope of practice because let me tell you, that industry do not care and will throw you under the bus. No hesitation once you mess up for taking the load that they ask you to take and care for. And the pay inequity, because going from, say, Iowa to California is crazy of the pay fluctuation. For example, they talked about how the pay was going in South California. I know for sure, like places in the north western area, nobody wants to fill those jobs. They have a nurse shortage, but the pay is like at for travel nursing, the pay is dirt cheap. So you already know you are understaffed. You also know that you need these patients to be cared for, but yet you don't want to give us the pay we need. Make it make sense. The math is not mathing. The physical and psychological abuse nurses and health professionals endure on a daily basis is unlike any other profession. It's true. The COVID-19 pandemic exacerbated that, but at this point, we are looking for something else to do. As far as what needs to be changed to alleviate the challenges that nurses face, allegedly, Washington is stressing the need to help nurses and to manage their workload through delegating certain tasks and offering new technologies. I don't know what they mean by technologies, but nurses do delegate tasks. But sometimes, guess what? There's no one to delegate the tasks to because we're understaffed. I don't even know what this means. Mentoring is also considered to be another way to support new nurses. If all the nurses who have the experience have left the floor due to physical and mental abuse, who's going to train them? Who's going to mentor? My mentor was an OG. Oh, I loved Barb. But Barb had bad knees and she was tired. The nurses are tired by the time they get to that age where they can actually give you this information and pass on this wisdom. I don't know what we're going to do. I really worry about this profession. Like, honestly, I'm really worried. Workplace safety is also very important. And I've seen patients come yelling at our staff when they're getting checked in and threatening to throw hot coffee into the person's face. And you know what happened to them? Nothing. Because at the end of the day, it seems like management cares more about the patients being satisfied than the actual staff. And this is another reason why nurses are leaving the bedside, because we feel we are unsupported, completely unsupported. We knew we needed to make recruitment and retention top priority, so they've pledged to invest in team members like never before. I hope so, because that is one of the problems, actually hiring people and keeping them. And I feel like that can be done by actually putting the work in to talk about the problems on the floor with the staff who actually knows the problems and actually correcting those problems. Just listening without actions is not going to do the nursing profession any good, and we will continue to leave. We will continue to leave in groves. But between the abuse, the tiredom, the patient care, the pay, we might as well be social media influencers. I mean, let's keep it 100. Comment y'all thoughts below.